get started. So welcome to a live episode of the Questions with Crocker podcast. I am Dr. Tanisha Crocker, an emergency veterinarian and practice owner. My co-host is my husband, Shane.
Who has no idea why I'm up here.
He brings levity and banter to
I'm not adding any value to this conversation.
And then we have an amazing guest. I had to bring on someone much smarter than me to discuss this and talk more about Parvo and the new canine Parvo monoclonal antibody. So Dr. Miller is here. Say hi, Dr. Miller.
Hello. Definitely not smarter than Dr. Crocker, but happy to be here today talking about Parvo.
And I will be honest. I need to admit this. I was 43 years old when I found out that it is Elanco and not Elanco.
Elanco.
Oh.
Elanco, not Elanco.
I said it. I
still don't know.
Can't get it right.
Yep.
Oh my gosh, you guys.
We actually have this at orientation. How do you pronounce the name of the company? So, here we go. Orientation to Elanco 101.
Okay. Well, now I'm like 43 and days old that I learned it. So I am excited because I live in Texas. I'm an emergency veterinarian. I think a lot of people here probably experience Parvo, and that's why they want to know more about what has happened, what we've seen change, and really the new hope that we've gotten with the monoclonal antibody. But the way this podcast is structured is we take questions, a lot of questions from online, and we'll do a couple in person at the very end. And we're just going to talk a little bit about Parvo, answer those questions, and then get more into the actual treatment.
Can we think about our audience back home, like my grandparents who are probably saying, what is Parvo?
Actually,
like I know there's puppies that have diarrhea that smell like death, but what else are we looking for?
That's such a wonderful explanation. So I didn't even tee you up for that. You lead me right into our first question. So at cabinetveterinary.Kaleem wanted to know, what is this treatment? What is Parvo? So do you want to give kind of the way you would explain it to pet owners? Because I will say one of the things I see is I still have pet owners where I walk in and I say, your dog has Parvo. This is what we need to do. Here's the options. And I give them a spiel. And at the end, I say, what questions do you have? And they say, what is Parvo? So let's explain what it is, maybe in layman's terms first for Shane. We got to make sure he's included. And then we can get more scientific as we go along.
Absolutely. So, I think a lot of us know here that canine parvovirus is this absolutely deadly virus that affects puppies. And really, it can affect any dog, but puppies are the primary audience because they've not been completely through their vaccine series yet. And unfortunately, it's a really hardy virus, right? So it lives in the environment for quite some time and it's microscopic. So that puppy that you just got, they're walking through the dog park or wherever they're out and about.
Don't take your puppy to the dog park.
People are just so excited. They got that puppy. They want to show it off. They walk through the environment. All they have to do is go back, groom their paws, normal puppy behavior, and then they can get exposure to that virus because it's so hardy in the environment. Even in Texas heat, can live for up to a year in the environment. So really affects those puppies primarily. 6 weeks to 6 months of age have the most severe signs associated with parvovirus. And when I've been talking about Parvo, I've been really struck by the low animal owner awareness of this virus. We did some market research and we found that 44% of dog owners, so these are people that already have a dog, they know about Parvo. 20% have no idea about the virus at all. And then also we see quite a bit of Parvo in the U.S. We've got about 330,000 cases of Parvo in the U.S. each year, which translates down to about 900 cases each and every day that are diagnosed. So those are the ones coming into the clinic getting diagnosed with this. Once it's in the system, Parvo causes those classic signs, vomiting, diarrhea, often with blood in those. They're getting really mopey. They're getting lethargic. They're down and out. We've all seen that Parvo puppy. You could probably have the smell in your memory right now, right? Because it just marks your brain. As we pivot over to what this new treatment is, it is a canine parvovirus monoclonal antibody, which is the first and only conditionally approved treatment for Parvo, conditionally approved through the USDA. So what it does is it actually targets the virus itself. Everything else we've had from the start of Parvo to now has been supportive care, helping these guys fight through this viral infection on their own. But now we've got something that's actually going to stop that virus from entering into the guts and causing more destruction for the puppy.
What is monoclonal? What is that? What is
monoclonal antibody? Yeah.
Got it. I don't know what it means, but
So it basically targets something specific in the system and binds to it, so that can't then go into the cell, or in our case, Parvo likes to enter the intestinal cells and cause major issues. So it binds that virus so that it can't cause worse infection.
Mm-hmm.
And so it's created specifically for it. And we have a couple other things that also use monoclonal antibodies, but this is the one that honestly I use the most and I've been using for a while now. That's probably the simplest explanation for it. Are you all about Parvo now? You got
I'll
it.
study that in finance. So
You got
that's enough for me.
You got it figured out. So I do like that you brought up, we could only do supportive care in the past. I think that's, for me, the biggest difference and the biggest mind shift that I think we have to have in veterinary medicine is we've always looked at this as, okay, they have Parvo. I need to make sure that we maintain their hydration, their blood pressure. We stop the vomiting. We try to help with the secondary infections. And now we have something where we can actually try to stop the virus. And that is such a different way to look at it. And I think it affects case selection for us, and it affects other recommendations. So at Crystal Adaman wanted to know, how quickly does it work? And do Parvo patients need to be hospitalized along with the treatments? I have my opinion from clinical practice, but what does your data tell you?
Yeah, I'll tell you, once we administered the canine parvovirus monoclonal antibody, I'm going to call it CPMA from here on out because it's a mouthful. It's a really long term. So
Thank you
CPMA for short. But once we administered it to puppies, what we saw is that they really get high blood levels really quickly. So this is a single IV injection. Then it delivers this high blood level of the antibody really quickly, enabling them to stop that virus from entering into the gut and really stop that effect of the destruction of Parvo. In our studies, we actually saw that none of these Parvo-infected dogs that received CPMA died from the viral infection, and it was the only thing that they were given. Like, this was the only treatment. So as you guys know, I mean, you still have to do the other stuff, the supportive care, the fluids, get them through that dehydration moment, that everything else they're going through. But we really see quite good improvements quickly with this product. But I'll let you talk to what you're seeing in practice.
Yeah, so we use it in the ER, and we also use it in GP, and we use it, I think, a little differently in each situation. We probably see more severe cases in the ER. Like, we see those puppies that are more advanced in their disease process. Maybe they don't have a primary veterinarian. That's why they're not vaccinated, and they waited a while to come in, which is why education on signs of Parvo and coming in sooner is really important. But those dogs, if they're really out of it, they need to be hospitalized, and I administer it plus do supportive care. A lot of times within 24 hours, I'm seeing an improvement. Sometimes it's 12, 18 hours. So it's a pretty quick improvement in my opinion. A lot of the ones that we do in my GP hospital, we treat outpatient. We don't hospitalize Parvo patients. And we actually treat for a fair amount of local hospitals that don't carry this medication. We've put out that we carry it. We have vets that'll diagnose and send their patients to us. We'll administer it, and then we'll send them back. But I will do a lot outpatient. We always call and check on them the next day. And I think part of it is probably case selection. They're stable enough to go home. But all those dogs have done really, really well after we've administered the medication, and we always get a good report the next day. So I wouldn't say there's, they all have to be hospitalized. I think you can have the opportunity to do outpatient based on the patient's clinical status. But it is a conversation to have with the owner. I particularly, and we've talked about this a lot, vet med's a little slow to change how we think and how we do things. So I'll see a lot of people say, well, I'll do these things first, but if it doesn't work, I'll give CPMA. My mind shift is totally different. If I have the funds, this is the first thing I'm going to give, and I'm going to give minimal supportive care versus ton of aggressive supportive care, and then use this 24 hours later if I'm not seeing a response. I think you're going to have a better outcome, and that's kind of what I've seen. But it is a mind shift switch because it's not a cheap treatment. And so people kind of want to try to save money. But I think in the long run, if you're more aggressive, you see better outcomes.
Yeah, and I think that's really important to, if you are going to administer CPMA to a patient, try to get it on board at that time of diagnosis, right? Because that's stopping the virus from causing additional destruction in these patients. So you don't want to, kind of wait around and see, let's do it on day 3. Like if you had used it day 1, you might actually be seeing these guys going home by day 3. So let's try to get it on board as early as possible in that disease so we can stop additional destruction to these gut cells.
I do think that patient selection is important, and also like what symptoms they have. So Atlin Kelsey wanted to know, do they have to be newly symptomatic or not? And you mentioned your study, which I've had some feedback where people say, the study said this, but what was the selection criteria? What patients did they have? How critical were they? So can you speak a little bit more to that? Because your study was super successful, but we're seeing, sometimes more critical patients, I suspect, than maybe you guys treated with just the treatment.
Yeah. So in the study, we basically challenged these guys or got them infected with Parvo and then waited until they showed clinical signs and tested positive for Parvo. So in the study, it was actually at day 4 after getting exposed to Parvo that they all snapped positive, and most of them had clinical signs at that time. I realize that that's not real world, right? Nobody knows exactly when that Parvo dog gets infected or exposed to Parvo. And most of the time, they're not coming in at that first day of clinical sign, right? Like it's usually, oh, he puked a little bit. Let me wait. Oh, the next day, this is really bad. Maybe we should get into the vet. So it's not exactly real world scenario, but it is aligned with what USDA required for the study for parvovirus studies. So that's how it was designed and how we carried it out in the studies.
So my feeling would be we need to do a better job of trying to educate pet owners to come in sooner, to be treated sooner, and we would see better success rates if your practice is not experiencing as good a success rates as reported. I still use it. I still think it works really well, but I do think that needs to be considered, and probably a discussion in your hospital of who are we giving it to? How quickly are we getting them in here? People are calling and saying they have a puppy that's vomiting. Do we tell them, oh, don't feed them and see how they do overnight? Or do we say they are not vaccinated? Let's bring them in right now, even if they're still jumping around, and let's make sure we're jumping on, the front part of this. So, Shane, do you know what Serenia and Convenia are?
Not a clue.
Okay. All right. So the next question.
They're not golf balls, I can tell you that.
Not, no.
Like Callaway and Titleist.
I do know those, actually. Yeah. So at Elizabeth Solomon wanted to know, are you still doing Serenia, Convenia, and SubQ fluids as well? So Serenia is an anti-nausea medication. You can give the injection, lasts about 24 hours, and they should not vomit. And then Convenia is a antibiotic injection, and it lasts quite a while. So basically, it's that supportive care we've talked about that's kind of outpatient. I don't know, have you treated any outpatient with clinical practice at all or gotten any feedback on that? I know I can share what I do, but.
Yeah, I've had feedback that in the outpatient protocols that they're still seeing really good outcomes with having CPMA included in that outpatient protocol. So still doing what they would normally do for those patients, including CPMA, and that they're seeing good results. So we actually did some surveys with CPMA using clinics and found that they're seeing around a 93% survival rate of CPMA treated puppies in real world cases. So I know it's always like, okay, you launch with a product, you've got the study information, which is not real world. And then they're like, okay, well, what are you really seeing in clinical practice? And it was pretty encouraging to me that they're seeing a pretty high success rate in getting these puppies to pull through in real world cases.
So what's the difference between having the CPMA on board and not? I mean, is the survival rate a lot less than 90%?
Yeah, typically for outpatient protocols, what's in the literature is somewhere between 70 to 80% survival rate. If you're doing outpatient without CPMA, that's what's out there published.
And we developed kind of a package of, if you have an exam, a Parvo test, and you're getting CPMA, it's based off of weight, obviously, because it's dosed based off of weight. But I only do SubQ fluids and Serenia with a lot of them that are still stable, and they do really well. I don't do much else unless they're having obviously straight bloody diarrhea or look really bad. And I've had really good success with I guess, being less aggressive with some of the other supportive measures we've done in the past. But it seems like they're either jumping around, acting like they're fine, right, and parvo positive, or they're laying on the ground trying to actively die. Like that seems like the extremes I see most of the time. So that's been my experience. Now, this is probably one of the number one questions that we have gotten, and I think it's important to address from a business side of things and also just overall with this medication. So at Lacey Lubovicki wanted to know, what is the cost to the client? And at Macaroni RBT said, there's pushback from doctors on the cost versus traditional treatment. So when do you choose to give it? And so full transparency, it's about $1,600 for 8 doses. That's the cost to the hospital. And a vial treats 11 pounds and under. So a lot of your puppies might fall in that 1 vial range, but some are going to go over. And so from a business perspective, do you want to speak a little bit to price and cost and how we're doing it?
I'm sure we're not charging enough. That'd be my
You never
gut.
feel like we're charging enough.
No.
Yeah.
No, I think it's definitely profitable. I think our markup, we charge, it costs us what, $200 a vial, we charge $400.
Yeah.
So I think our markup's there. But I think more importantly, you're getting the patient out of the hospital faster. So at the end of the day, even though we're profitable, I think it's the right thing to do to try to get the patient healthy and get them out of there faster.
Yeah, I mean, I like...
And it's got a shelf. I mean, I know the upfront cost is a big deal, but I think when I asked that question, it had like a 2-year shelf life or something like that. So it's not like we're not going to see a parvo puppy over 2 years.
Yeah, we call Shane like the finance guy in our practice because he's in charge of cost of goods and inventory management. And so when we kind of talked about bringing this on board, that was one of the number one questions was, how much parvo do we see? How long will this last? And a 2-year shelf life is huge. And I'm pretty sure there's the option to even return it if you don't use it in that time period. So to me, it is an initial decent upfront cost. But I will tell you,
we spend more than that on random stuff, coffee and water and other crap that we buy.
I mean, I need my coffee. I don't know what to tell you. But I do think that just as a practice and a culture, we want to be able to offer an option. We don't want to say, this is too expensive, we're not going to have it available. And honestly, I've been surprised when I tell people and explain how it works and I talk about it and educate on parvo, I get a lot more buy-in than I felt like I would have in our general practice. Now, it is priced more in the specialty hospital and ERs, and a lot of them are just set up that way. They're 24-hour facilities. They pay everybody more. But again, in the ER, I'm still getting people saying yes to it, or I am able to direct them to a general practice in the area that has it for less. So I don't think it's something that's unattainable for practice owners. And our team loves the fact that we can actually help these puppies and give them an option.
When did we start carrying this?
We started carrying, I don't know, we've gone through...
I think
3 boxes now.
Yeah, I think we've ordered several times.
And it's less than a year that we've carried it. So we've used it. And that's just in my GP hospital. In the ER, we probably use it, several times a week. Some of the amazing vet techs I work with are here. So that's why I was asking.
And I'll just add on to that because there are a couple of extra financial incentives for using the product. One is, if you don't use that product within the expiry date, like around that 60-day window of product expiring, there is a return policy. So you can get money back if you don't use the product in that whole time. But I also think of it as 2 years shelf life. Are you going to see 66 pounds of parvo in 2 years? Because that's what it equates to, right? Like if you're going to see 66 pounds of parvo, you're going to utilize this product in that 2-year shelf life and probably not need that return policy. Elanco also did set up a fund called the Defenders Fund. So whenever you order that carton of CPMA, you get $25 back to the clinic, credit to the clinic. And then if you submit success stories, so if you submit a cute little puppy success story, send that in, we give you another $25 for each puppy picture that you send us.
Didn't we use this on our mother-in-law's dog?
We did use it on, of course.
My mother-in-law's dog, your mom.
When you work in veterinary medicine,
right now.
Of course, you have a family or friend member that finds a stray dog, right? And it has a plethora of issues. So, of course, my own mother finds a stray dog. Turns out she's pregnant, has adorable football puppies. So cute. And then, of course, a couple weeks into having the puppies, they all break with parvo. A huge litter of puppies. And this was actually right when I had gotten CPMA. And I said, well, what's a better time to try it than on these puppies that, my mom has? And we had the opportunity to use it. And what we did is we tested all the puppies, all the positive ones, we gave it to IV. The negative ones, we knew they were exposed. And so off label, this is not a label recommendation, but we gave it to the ones that tested negative, SubQ, and all the puppies did really, really well. There was a puppy that had been adopted out, broke with Parvo. They did not give it, and that puppy did not make it. And they were all, diagnosed around the same time. They went to another veterinarian. So it was, for me, one, a great way to see how I felt like it worked, administer it in a couple of different ways. And also we were able to break the vials up and share them among the puppies. Now, once you mix it up, you only have so much time to give it. But if you have a group that has been exposed, even if they're testing negative, I would treat all of them with it if possible. And so that's been my first experience with it. And I was really impressed with it. And since then, I've treated tons and tons more pets and had a good response.
Yeah, great.
Any questions more about, you want to talk more about your mother-in-law, or she's probably listening?
She's listening and she's wonderful. My favorite mother-in-law I have.
All good things.
Yeah, she's watching our children, so we gotta know. Okay, so another good question we had that we get frequently at Joan Knack said, what is the vaccine recommendation after the shot is given, and how is it different from dogs that are treated with Parvo?
You want me to tackle vaccine?
That is all. This is all you. This is the stuff that I'm like, you just tell me what to tell the client, and that's what I'll do.
She gives me a softball of immunology after lunch. Okay,
yeah.
Let's dive in, right? So after you've used CPMA, it works very similar to a maternal antibody. So we know that it interferes with vaccination, right? So after you give CPMA, if you wanted to very conservatively wait about 17 to 20 weeks after the dose to vaccinate them, that drug, the CPMA, has worn off by that timeline. Then hitting them with a Parvo vaccine around 17 to 20 weeks after dose would give them their own immune system time to respond and build their own immunity. So I say that's a conservative recommendation because a Parvo-infected dog likely doesn't really need much in the way of Parvo vaccination, right? Like they've gotten infected, they've built their own immune response to that Parvo infection, so they probably don't need it. But I think it would be a very conservative approach to just go ahead and hit them with that last Parvo vaccine, 17 to 20 weeks. That being said, that's just Parvo, right? So everything else that you vaccinate a puppy for, distemper, adeno, parainfluenza, everything else, you want to keep on that vaccine schedule for those other antigens for that puppy. Once they're well, once they've recovered from Parvo, go ahead and keep on that vaccination schedule for these puppies. So that's how I would approach these guys. Additional data point, we did some antibody testing in our AVMA study, which actually looked at IgM levels, and we saw that CPMA-treated dogs did not have a blunted immune response to Parvo, so likely they're still developing a similar immune response to natural Parvo infection if they had CPMA or not had CPMA. So this is a precautionary tale, but I would say in general, 17 to 20 weeks after dose, make sure that's when that last Parvo vaccine is.
Well, and especially being in Texas, I mean, we see distemper cases, we see other things. So I like the fact that, you have to still educate on the value of the vaccine outside of just Parvo, and also talking about the long-term immunity and all the other factors that go into it. Yeah. But having those very clear-cut recommendations is great, because I was deer in the headlights the first time an owner said, well, what about the rest of the vaccines? And I'm like, And so that is extremely helpful. We're seeing more older dogs develop Parvo that have been vaccinated. So at Dr. Rogers 18 said, I'm curious if you're seeing it more often in older vaccinated dogs. Our area in Fort Worth seems to be abounding in it. So are you also getting reports of that? I know that you guys have the Parvo tracker where you can go online and you can look and see where Parvo positive cases are and see if your area is on an uptick. So are you getting the same sort of data?
I would say we get little cases here and there of older dogs that are getting Parvo. It's still not the commonality. Like, still we're seeing mostly puppies getting Parvo, but we do get occasional reports. And it seems like there's maybe a little bit of an uptick in the adult dog getting Parvo. My own theory is that there was some disruptions in vaccination for those adult dogs during puppyhood because of COVID, disruptions in care. So I just don't know how many of those guys actually got their full puppy vaccine series, leading them to be a little bit more susceptible as an adult dog. But that's my own impression. I don't know if you have another take on it.
We talk about a lot of stuff that aren't facts here, so it's okay.
We are not experts, so
we say a lot of stuff.
She is an expert, though. So, no, I do think that I am seeing a couple older, like 2-3-year-olds that are coming in that have it. And that's always the question. They say, yes, they're fully vaccinated, but like, what does that mean? When did they start them? When did they end them? Did they get a 6-week vaccine and they counted that, from a breeder? Did they stop after 16 weeks, 20 weeks? I mean, the recommendations have kind of increased to vaccinate later to get better long-term immunity. And so I think that there's maybe some questions somewhere, but we definitely have had a couple dogs that were fully vaccinated that had parvo. And those dogs, I've had quite a few receive the CPMA and they've recovered and gone home. So I think that it's still an option in the older dog if they absolutely need it.
Yep.
So one thing, and we've experienced this at our hospital, is allergic reactions. So we know that you can have an allergic reaction to anything. I have given Serenia to thousands of pets over the years. And I one time gave Serenia in the ER and the patient started to go home. And then all of a sudden it puffed up like a balloon and it started not acting right. And we're like, holy cow, like I didn't think I would see this, but this dog's having allergic reactions to Serenia. So we did have a puppy who we were administering it slowly IV. This puppy was pretty sick, but not the most sick we've given it to. And that puppy had a pretty significant reaction. So talk to me a little bit more about that. Have you gotten reports on that? What are your thoughts?
Yeah, I think anytime you're giving a biologic IV, there's always inherent risk, right? With a biologic or really any medication that you're administering IV, that you could have an allergic reaction. I mean, I've heard of some reports of that, like having these types of reactions to CPMA. And it's really hard to know what the causative agent is, right? They're few and far between. I know that whenever you see one, it kind of sticks with you because you're like, oh goodness, this puppy's collapsing, right?
Yes.
It's scary. It marks in your brain, right?
Yeah.
But in general, most of these guys bounce back and do quite well. So there's such a low number of the cases that it's really difficult to know what that trend is of why they're having any reactions. But I don't want to scare anybody off because it's a very, very low number that we're hearing about.
I mean, for me, it's risk versus benefit. And I still think that you have to try something. And so I think that it's worth doing and just monitoring and giving it slowly and making sure there's no issues. But I've given it many times and we've watched the pet for 30 minutes and sent them home and they've done great. And that's the majority of them too. So I still feel very comfortable giving it, but I do think just making sure that you are in a setting where you're monitoring closely and you have it available if there is an issue to give fluids, to give epinephrine, whatever you need to do is probably important. Do you agree?
Yeah, perfect. It's way over my pay grade.
Okay. So at Snow Rulies wanted to know, can I find this treatment in Spain?
Yeah, unfortunately, it's only in the U.S. for now. So it is a USDA conditionally approved product, and we cannot ship it outside the U.S. at this time. So stay tuned. Maybe new things later on, but nothing right now in Spain.
Can you share a little bit about the shipping and the maintenance of this product too? Because it's not something that you get in and you just put on the shelf. It's a little more intense than that.
Yeah, so this product is shipped on dry ice and it is freezer storage and specifically deep freezer storage. So it comes in like this big box. There's a layer of dry ice and then there's an inner freezer box and you can just take that freezer box and pop it straight into your freezer or your deep freezer. And it stays at freezer temperature for storage. So that's how it's stored. And that I think that's a lot of the complexity with some of the shipping things. And we get some of these questions about shipping them to, U.S. territories or outside the country and stuff. And yes, there's a regulatory component, but then there's also the logistics of how do we get it there? How can it get there cold and stay stable too?
And then once you mix it up, you have how long until you have to not use it again?
In general, you're going to want to use it that at the same setting. We don't really have like hey, it sat on the counter for this much time and then it's no good type studies. We don't have that information. So in general, what I would do is just try to use it at that time of diagnosis and quickly thereafter. So you don't want to refreeze it. You don't want to store it in the fridge and like keep it for a long time. Just kind of generally try to use it at that same time lane.
Yeah. We say 20 minutes is just what we say in our practice to make sure we're on it. They're ready to go and we give it. And I will say also it's given IV. I don't place IV catheters in everything that I give it to. We give it plenty of times just as an IV injection. And they do really, really well. So if cost is a concern, you don't want to place a catheter, you don't want to do all that. And they seem like they're stable. Obviously you need to monitor them, but IV injection does not mean IV catheter. And so that's just one thing to remember.
And I've had some folks that have used this as an IV medication to kind of bump that on the fence owner for like the outpatient protocol, right? Like, hey, I want to do all these IV things. Can you leave them with me for 4 hours or so to get them rehydrated? Let me go ahead and do a catheter, get some fluids and stuff in them. And they use this as a little bit of a tipping point to say, hey, I've got this IV med. I really need an IV catheter. Can you let me go ahead and do that? Keep them for the day and then they can go home that night. So, you can go either way on that, I think.
Yeah, no, I agree. Okay. At Rachel Kaufman wanted to know, are they making a Pan-Luke version for kitten?
Making a what?
Pan-Luke version?
Pan-Luke?
Yeah. So panleukopenia is similar, I guess, in like how it works in cats as Parvo works in dogs. So it attacks like the intestines. So the question would be like, can you make a similar product because it can be deadly in cats, just like Parvo is in dogs?
Yeah, it's
that clear as mud.
Yes.
And give you a little Parvo history, right? Like in the 1970s, they actually think that Parvo came to the dog from a jump from Pan-Luke from the cat to the dog because it's a very, very similar virus. There's only like 2 or 3 amino acid differences in these 2 viruses. So they're super similar. So yeah, using CPMA in a cat is off-label. I can't promote or recommend it. I will tell you that we've got some in vitro studies that show that there's virus neutralization with using CPMA in cats. But again, that's going to be at the veterinarian's own risk-benefit assessment because we don't have any in-cat study data to say, is it safe or is it effective? That being said, I've heard, especially in the shelter community, that's where a lot of these Pan-Luke cats are seen. And I've heard of some shelters using CPMA in Pan-Luke cats because, I think that they're just desperate for whatever they can use, right? And thinking that it'll still stop the virus too.
Yeah, that's good. That's good information. Do you have any questions about Parvo, the treatment, anything?
I'm ready for my DVM license. I'm good to go.
You're going to get out there, start working ER, start doing it. Well, I think that we've answered all the questions we got online. And so I wanted to open it up to people here that might have any questions about Parvo, the monoclonal antibody, any of that. Or if you want to share your experiences, that would be great too. So looks like we have a question at the back. And just a reminder while Harrison's
Harrison
back,
King, King Media.
Harrison's awesome.
Hello.
Hi.
What is the cost to the owner? And I'm sorry if you said this at the beginning. I came in a few minutes late. But what would the cost to the client be?
So great question. It's the most common question. We addressed it earlier, but so per vial, which covers an 11-pound pet, it's $200 a vial. So that's a cost to us to have it. So in our general practice, I charge about $400 a vial if owners are able to. I will tell you if I have a group of puppies or if I want to help out, sometimes we discount that out, especially if we can use multi-vials with multi-pets. You're so dramatic, I swear. In the ER specialty setting, it is marked up significantly more because it's a 24-hour facility, but I've still had people say yes to it and gotten good compliance, especially when you look at to hospitalize an RER for Parvo, we're giving a $4,000 to $6,000 estimate, and that's like a 24 to 48 hour estimate. Are you laughing? You think it's more? Okay, so apparently it's more is what they're saying. But But this decreases hospitalization if you give this medication. So it's usually worth the cost up front, right? To try to get them out of the hospital faster or to try outpatient.
And this is why veterinarians don't discuss finances.
Stop.
Is it 1 vial per treatment?
It's 1 vial per 11 pounds. So it depends on the pet's weight. But a majority of the Parvo puppies that we see, 1 vial seems to cover it. But sometimes it is 2. And then some of the 2-3-year-old dogs we've had have actually needed almost the entire thing. So.
And I'll just add, I mean, we hear the ER peeps over here saying like 8 to 12, right, for hospitalization associated with Parvo. And we've just gotten some recent numbers back from actual clinics using CPMA and how is it decreasing hospitalization time in the real world, in real world cases. And they're seeing about 1.87 days less hospitalization time when they're using CPMA. So I know it's an upfront added expense in the beginning, but if you can decrease that hospitalization time even 1 day, try to translate what does 1 day of hospitalization look like financially for your animal owners, and does that cover the cost of this upfront cost?
And I will tell you, like, we in my GP have made a cultural decision as a team that we want to offer something to these puppies. We know it's expensive to owners. So I work with owners. We take care credit. We take scratch pay. We have kind of a batch deal with our Parvo test and this treatment. And so I usually tell people, like, if you have $500, I can treat your dog outpatient. I can diagnose and treat them. And so I market that. I talk about it. We have a lot of pets sent to us from other hospitals that don't want to carry the treatment. So I think as a team, we just feel like this is kind of the right thing to do. And we want to use it because I hated not having options before. I hated saying, here's your, diarrhea medicine, here's your Serenia and your SubQ fluids. Let me teach you how to do SubQ fluids at home, and like, good luck with your pet if they didn't have $10,000 to treat. So for me, it has been really great, just the way that I practice, to have this as an option.
Yeah, you mentioned like with that, your mom's puppy litter, that you gave some of the ones that hadn't tested positive SubQ. Is SubQ considered off-label, or is it an acceptable administration?
So using CPMA SubQ for like the asymptomatic exposed pups, it is considered off-label. We can't promote or recommend it. That being said, we do have some study information showing that it was effective in utilizing it in that way. So it would come down to a risk-benefit assessment from the clinician and that informed consent piece with the owners, but it is technically off-label.
And obviously, it's going to not get as high a levels as fast versus giving IV, but especially in like an itty bitty puppy where I don't have a catheter in, or we don't have that as an option, I want to get it in there. So I like the fact that I can give it, and I've done it quite a few times, and this is my experience, but it's worked well.
So have you guys been able to see it be just as effective at every stage of the disease as it is with mild symptoms or super severe symptoms, or is it more effective in one more than the other?
Anecdotally, I think it's more effective earlier in the disease because it makes sense, right? You're binding the Parvo, so it doesn't have a chance to cause as much damage. But I have seen more critical patients, I feel like, get better faster with it also. Like ones where I'm like, that dog looks like crap. And I like go off shift and I come back the next day and it's like ripping its catheter out, like crying because it wants attention. And you're like, what happened? And they're like, I guess it feels better. And usually it would have taken much longer to see that response. So, and that's anecdotally, but that's definitely my experience.
Yeah, the study information we have is from early in the course of the disease. So we don't have study information looking at every stage of the disease, unfortunately. So even the information I have is anecdotal. But part of my role is I hear about cases across the U.S. And a couple stick out. Like one was, I had this puppy that was like laterally recumbent. It was when we were first shipping product out. So they didn't have it at the clinic. They had to wait like 2 or 3 days in the ICU. This puppy was not looking good, had like no white no white blood cells, like nothing. They gave this whenever they first got it. And then the next day, the dog's feeling better. And by 48 hours, they're like discharging this dog to go home. So that was like a veterinarian owner relinquished the dog. So the veterinarian now has this dog. And they were just so astounded by how fast that dog rebounded from feeling down and out and lateral to like feeling better and getting back to normal puppy behaviors.
Mm-hmm.
So and I've heard some similar experiences and testimonials like that. So in my opinion, I don't think there's any course that's too late to use it in. If you have somebody that can afford it, I would use it in any course of the disease because we've heard some really dramatic recoveries too.
And I feel like with the critical ones in the past, I'd be like, okay, let's just get to the point that they're like maybe interested in food. They're not regurging. They're not having straight blood come out their butt. Like they're stable. And then I like am going to try to get them home to keep recovering because the owners like can't afford it anymore. Or like they don't have to be hospitalized anymore. With these dogs, I feel like I'm like, oh, this dog's better. Like this dog can go home versus this dog is stable enough to go home, but still needs time. I think that's probably a bigger difference that I see personally. But Dr. Deere, what do you feel like with the ones you've seen and treated?
Can you hear me?
Yes.
Okay. Kind of the same thing. I agree. I think case selection is important in all aspects of emergency medicine. And I told a story to you earlier about a dog that had been vomiting for 4 hours, tested positive for Parvo. We hospitalized it. We gave it the monoclonal, and 12 hours later, chewing out the catheter, and seeing like that quick resolution when you give it early enough. So it seems like it's on par with my personal experience. I haven't had one that's super critical yet.
Yeah.
But we have like a listserv in one of the hospitals I work at, and we're always like telling each other, hey, I gave it to this patient and this worked, or for any medication. So
yeah, we're going to pass the microphone over so we can hear you and so it gets recorded. But I do want to mention, if you want to follow the podcast in the future, you can follow at Questions with Crocker, and you can listen to us on Spotify and Apple Podcasts. Okay.
So the question was just, do you have to redose any of these patients at all?
Not in my experience, no.
No, really that the monoclonal antibody is going to be delivering quite high levels of circulating antibody. So, they say anything above 80 of circulating antibodies, usually a protective level. And this is delivering around like 5,000 to 20 the day after dosing. And that monoclonal antibody has a similar degradation as a maternal antibody. So it's going to stick around for quite some time. That's why we have to revaccinate so far out, is because it's still kind of circulating in the system. So no, we haven't seen much of any having to redose.
My question is about for vaccinating them, 17, 20 weeks after you vaccinate them, then would you then booster them again 2 to 4 weeks afterwards? Because a lot of the cases that I'm seeing, they've either never been vaccinated or they got like 1 5-way at 6 weeks old or something like that.
Right. So for the Parvo infected dog that receives CPMA, probably one vaccine at 17 to 20 weeks post-dose is adequate. If you wanted to be super conservative, you would do a 2-part series. You could always pull titers if you wanted to check, around 2 to 3 weeks after vaccination and see what those titers are and make sure that they're mounting their own response. I know titers are not that practical. People don't really do them a ton unless you've got somebody that wants to avoid vaccination in general. But that would be a way if you wanted to check, you could do that. But probably 1 dose is fine. If you wanted to be super conservative, 2 doses would be okay.
And there's some resources. If you want more information, you can go to www.defeatparvo.com. There actually a pledge on there you can sign if you want to help with like getting information out about the Parvo and the treatments and tracking and just doing all the things that we should do for the client side of things, but also for treatment. Is there any other resources that you think are good to share that they know about? That's the biggest one.
Yeah, I'll just add on that Parvo tracking map. So it's like an interactive map where animal owners and clinics can submit cases of Parvo positives, and they can also see if there's Parvo in their area. Additionally, people can look and see if a clinic has CPMA in stock. So if you have that Parvo patient that's trying to find the treatment, they can find you on that website as well. So I just wanted to call that out, that some animal owners are out there searching. And I know that you've mentioned some of your practices on how you can gain some business in that way, right? But yeah, this is such a terrible disease with such low animal owner awareness. Like Elanco's trying to go on this big educational campaign for animal owners to increase awareness about Parvo, increase awareness that there is this treatment out there to help save these puppies, because we're on this mission to save 1 million puppies from Parvo by 2030.
Yeah. So you can sign the pledge at the
One more
booth.
question over there.
One more question.
Hey, yes, ma'am. I actually have 2 questions. One, you talk about on the vaccinations that the other vaccinations they're fine to give as scheduled. Does that include Bordetella and rabies as well?
Yes.
Okay. And then I know it's off-label use, but when you gave the shot SubQ, were there any negative effects given it, like no skin irritation or problems?
No, it was really nice because my mom had the puppies, so I could check on them. And she lives next door to us. That's why Shane loves his mother-in-law. And so I was able to go over there, see how they were doing. And I mean, they were running around within 24 hours, like all of them looking dramatically better. And there was no heat, swelling, discomfort, hair loss that I saw in any of those puppies. And they tolerated it well. Like when we gave it, there wasn't kind of that sensitivity you can get with other medications. And that's another reason why I personally feel okay giving it IV without a catheter, knowing it can go SubQ. It's not like one of those, it's going to slough the skin off if that goes a little SubQ. But again, that's off-label recommendations. We're not experts. Any other questions? I think we have to wrap up here in a minute. I do appreciate you guys coming. If you want to go and share this episode with anyone in the future, you can follow us at Questions with Crocker, and you can actually share it off of Spotify or Apple Podcasts. You can leave a review, give us feedback.
Positive feedback.
Yeah, positive feedback. And we do appreciate AVMA letting us podcast live and get the word out more about this and talk about it, because the client education side is so important. But also just really encouraging you guys, if you've been nervous to use it, if you weren't sure about it, hopefully hearing a little bit more from the expert and from someone who's used it a lot will make you a little more comfortable. Anything else you want to add?
Nope.
You know everything you
Time
need to
for
know
lunch.
about Parvo? We are hungry, yeah. Dr. Miller, thank you so much for coming, joining us.
Thank you for having me. This has been fun.
Yeah, you guys have a great day, and thanks a lot.